Hello, welcome to our presentation. Our team includes 6 people: Đinh Kim Sơn, Trịnh Thùy Linh, Nguyễn Tùng Dương, Nguyễn Đình Lương, Lê Bá Thành, and Vũ Việt Phương An. Our presentation is the effect of virgin coconut oil in the inhibition of SARS-CoV-2 via direct virus inactivation and regulation of inflammatory response via TLR4 receptor. My name is Đinh Kim Sơn and I will present the introduction. Virgin coconut oil, VCO, is the purest form of coconut oil that consists mainly of medium chain rich saturated fatty acids. For over many decades, the biological properties of VCO have been widely explored and investigated due to their antimicrobial potentials. Severe acute respiratory syndrome coronavirus 2 SARS-CoV-2 infection presents a significant number of patients die to date. Some drug and herbal extracts have been approved for the treatment of SARS-CoV-2 in several countries, but its use has not decreased mortality rates. SARS-CoV-2 to cell surface TLR have been demonstrated to be a vital mediator of COVID-19 immunopathogenesis for signaling pathways originated from TLR5 and TLR4, leading to the activation of mitogen activated protein kinases and/or nuclear factor Kb, induce the expression of pro-inflammatory cytokine. Our aim are: first one, the process of producing virgin coconut oil VCO from Vietnamese coconut fruit. Second one, the investigating the effect of VCO for the mechanisms underlying the anti-SARS-CoV-2 activity. And last but not least, investigating the effect of VCO for suppressing the inflammatory induced LPS in bone marrow derived macrophage. Next is Lương.
Hi everyone, my name is Lương. Now I will present about Figure 1, Figure 2 and Figure 3. Figure 1, the process of spore production of VCO from coconut fruit. Figure 2, high performance liquid chromatography for standard and sample lauric acid from VCO. The purified sample and standard and lauric acid were measured by HPLC. The partial purified extract were collected and concentrated for taking with standard lauric acid by HPLC. The result indicated that there was compatibility between both sample lauric acid and standard lauric acid in shape and the retention time. Figure 2A and 2B. Figure 3. VCO was carried out to measure the inhibition of virus-induced cell death. VCO inhibited at 1.2 mg per milliliter. The next one is Linh.
My name is Linh and I will present about the Figure 4, 5, 6 and 7. First, Figure 4, which is type of drug addition assay. PLE, which is about 1.25 mg per milliliter, was accumulated with 0.6 cells in 6 well plates, 1 milliliter per well, between -3 hour to 0 hour PI, post-infections, between -1 hour to 0 hour PI, between 0 hour PI to 24 hour PI, and between -3 hour PI and 24 hour PI at 37 degrees. The virus was absorbed to cells when between -1 hour PI and 0 hour PI at a MOI of 0.01. In Figure 5 and Figure 6, compared with the mock-treated control, the additions of VCO was markedly inhibited viral RNA and protein synthesis at treatment course from -3 hour PI to 24 hour PI. The VCO showed stronger inhibitory activity when it was added at earlier time points, which were -3 hour PI to 0 hour PI and -1 hour PI to 0-hour PI than it was added between 0-hour PI to 24-hour PI. In Figure 7, these findings indicate that the VCO may play a role in blocking the viral entry. VCO treatment inhibited SARS-CoV-2 plaque formations in a dose-dependent manner. And next, Dương will take over the next part.
Hello, my name is Tung Dương, and I talk about Figure 8 and Figure 9. In TNFA, IL-6, IL-12, B40 were cyclically inhibited in cell by treatment with VCO. Figure 9, mitogens activated protein case MAPK activation reduced in induction of numerous pro-inflammatory molecules after patent recognition receptor site signaling activation with LPS. The current data shows that VCO positive modulate the LPS induct phosphorylation of P38 ERK1/2 MAPK. Next is time.
Hello, I'm Thanh and I'm gonna talk about Figure 10, 11, and 12. LPS can stimulate the production of reactive oxygen species, or we can call it ROS, in myeloid cells, and NADPH oxidase is the main enzyme of producing superoxide in mononuclear phagocyte. Therefore, we investigated VCO inhibited LPS include ROS generation and NADPH oxidase activities in macrophage. Next is Anne.
Hi, I am Anne and now we will talk about the conclusions. The process of VCO with lactic acid greater than 75% from Vietnamese coconut fruit was produced. VCO had EC50 of 0.1 plus or minus 0.02 milligram per milliliter against the viral E6 cells. VCO is capable of inhibiting SARS-CoV-2 replications by inactivating the variant. VCO's 40 microgram per milliliter decrease the LPS mediates secretions by thermal necrosis factor, the TNF-alpha, interleukin, IL-6, IL-12, but not the IL-10 in macrophage. VCO's 40 microgram per milliliter inhibited the LPS, induced activations of mitochondrial activates proteins, kinase, MAPKs, the extracellular signal regulates kinase, the ERK, and 1.5 and P38. VCO's 40 microgram per milliliter suppressed the superoxide generations, NADPH, oxidase activities, and phosphorylations of CR345 of P47 spots. One of the key inextracranial events associated with NADPH oxidase. Our data may prompt additional investigations on the clinical usefulness of VCO for preventing or treating COVID-19 and suggest novel approach for the excessive inflammatory response. This is the end of our presentations. Thanks for listening.